Hello, Pharmative friends. This is Dr. James Partyka. I'm coming to you live from the Los Angeles, California, and this is Pharmative Live on Facebook Live. And before we begin, I'd like to give a shout out to the Pharmative's creative director, Jimmy Mann. I want to shout out to a few new Pharmative members in India and Brazil. Welcome again to Pharmative Live. This is our opportunity to connect with each other, to share ideas and information, to educate ourselves, all to improve our healthcare. So that's Pharmative, and this is Pharmative Live. And I want to welcome all of you here today. I'm actually working at a pharmacy meeting. Many days of working hard on various medications and new breakthroughs. I'm just going to talk a little bit about getting to know your pharmacist. Truly, in the United States, your pharmacist is the medication expert. And it's important that you get to know your pharmacist. So if you have questions about medications or drug interactions or about adverse events or about what's the best medication I should take for the symptoms I have, you can go up to your pharmacist, and at no extra charge, he will give you or she will give you the right information to help you take your medications appropriately and safely. So that's number one. Now, pharmacists go to school in the United States for 6 to 10 years, and there's all different kinds of pharmacists out there. There's hospital pharmacists, there's community pharmacists at your various retail pharmacy stores. There are nuclear pharmacists, there are cancer pharmacists with specialty training, pediatric pharmacists for the little ones. So there's all different types of pharmacists. Pharmacists practice in many different types of settings. They practice all over, helping to optimize medication therapy so that the benefits of the medication far outweigh the risks. They also are involved in selection of medications that are the most effective, but also the least expensive. So I'm going to remind you of a few recommendations from myself to you. And again, you can always type or text a question right now, or you can send it to us at info@pharmative.com. So I'm going to remind you of a couple things. One is, if you're in the pharmacy and you have a choice between the brand name or the generic name, you're going to choose the generic because the FDA has determined them to be FDA equivalent, and it's going to most likely save you money. However, you want to compare the count of pills in the bottle, and you want to compare the price. And obviously, if the price of the brand is cheaper because it's on sale or something, then choose the brand if you'd like. But ultimately, the FDA has determined that the generic drug is bioequivalent to that of the brand drug. So you want to choose the generic. Don't think that you're spending extra money is going to work better or not. Okay, so choose the generic. And remember, we always talk about the benefit versus the risk. The benefit in the case of acetaminophen, the common brand name is Tylenol, is either relieving pain or reducing fever. And the risks are going to be the side effects. And so we're always going to have to constantly weigh the benefits versus the risk. And obviously, if there's minimal benefit to no benefit, we're not going to take the drug. And we're going to take the drug as directed on the packaging label. So again, benefits versus risk versus cost, which is something we talk at Pharmative all the time. And now I'm going to talk a little bit about acetaminophen, Tylenol. And when we talk about pain medications which are available over the counter, acetaminophen is one, okay? And it's in a separate category from all the other medications, which include aspirin and ibuprofen, naproxen, and a number of other drugs which are available over the counter are grouped as non-steroidal anti-inflammatory drugs. And they're different than acetaminophen because they have an anti-inflammatory effect. Okay, so we have acetaminophen, which is effective for reducing pain and fever. Then we have the non-steroidal anti-inflammatory drugs, often referred to as NSAIDs. Those drugs also reduce pain, reduce fever, and they reduce inflammation. So if you're suffering from osteoarthritis, which is an inflammatory disease, you would want to select an NSAID over acetaminophen because it has an anti-inflammatory effect. And we're going to talk more about these drugs at future Pharmative Lives and on Pharmative.com. But I just wanted to make that distinction. Again, acetaminophen and Tylenol, which can be used in children and adults and available over the counter in the United States, is an effective drug for reducing pain and fever. But if you're looking for anti-inflammatory effects, you're going to choose, more than likely, unless there is a contraindication, you're going to select an NSAID that's very effective for osteoarthritis, for back pain, and so forth. And we're only going to take the medication for as long as we need to, generally a short duration. But if you're needing the medication for longer than expected time, more than a few days, then you want to perhaps see a healthcare professional, see your doctor, your nurse, your pharmacist, and talk over the benefits again versus the risks. Now, there's just one other thing I want to tell you about acetaminophen, and I want to remind you all that the maximum dose of acetaminophen for an adult is 3,250 milligrams per day. And anything above that amount increases your risk to developing hepatotoxicity. And the hepatotoxicity can be life-threatening, can be irreversible. Now, acetaminophen comes in many different combination products as a single agent. And so you could be taking cold medication and then be taking something for pain and not realize how much Tylenol you're actually consuming. So again, one of the purposes of today's Pharmative Live is to read the directions on your packaging, read your precautionary and warning statements, assess the benefit versus the risk versus the cost ratio, and then remember, you shouldn't be taking any more acetaminophen, and we're talking about adults, than 3,250 milligrams, which is 3.25 grams of Tylenol per day. Now, if you're a patient who has hepatic impairment, liver impairment, or you have a drinking problem, those people should probably avoid Tylenol unless absolutely necessary. One day we'll go over in more detail the pathways of Tylenol, but that's what I want you to take home today. Don't take too much Tylenol. There are other alternative choices available to you and your doctors and nurses and pharmacists. So that's it for today. This is Pharmative Live, coming to you live from Los Angeles. I want to say hello to Bill and Jimmy and Thiago and Steven, and say, stay healthy. Remember, you can always go to Pharmative.com and go to the live channel network, and you'll see all of our videos. We're also available on YouTube. So signing off, this is Dr. James Partyka, live from Los Angeles. And remember to stay healthy, and I'll see you next week.